Hi, my name is Tim McClain. I'm a nursing student at the University of South Alabama, and today I'm performing the Indwelling catheter care. This is my card. Okay, you can scan the room. Okay, once the room is scanned, I will walk into the patient room. I'll wash my hand and perform hand hygiene. Then I will look at the patient care order form and verify with the hospital policy. And then his name is Jaguar Jones. 0825-1963, 0825-1963. He's allergic to penicillin. I did 2 identifications and his allergies. Next, I'm gonna read off at least 3 things about maintaining indwelling urinary care. They require immunizations for surgery, trauma, or the therapies. They acute ventilator-dependent respiratory failure and acute worsening of mental status. Once that is done, I will lower side rails, raise the bed, and place my patient in dorsal recumbent position. His legs used to be need to be slightly bent, but today since I got towels, I can't do that. Then I will also don goggles. And then I also privacy and trash can. Then I'll wash my hands again. Once I wash my hands again, then I will do the dorsal recumbent position. After that, I will put on my gloves. Next, I will perform pericare to my patient. I will position my patient dorsal recumbent, and then I will normally verbalize. I'll wear gloves. I will close the labial, and I will do this side, throw away. Then I will go this side, and then throw away. Then I will open the labial, and I'll go right down the middle, and then I will throw it away. Once I've done that, I will also do the male. The male is, I would take the male's penis in my non-dominant hand. With my dominant hand, I will go around the meatus, going outwards down, and then I will throw away the gauze I used on it with soap and water, warm soap and water. Next, I will take this. Okay. I will use this as a trash can. Okay. Then I will get my sterile gloves and I'll don my sterile gloves. Okay, I'll do my right hand first. Go. Okay, to do my right hand, I'll take 2 fingers. Okay, once I do that, now I can put on my gloves correctly. Once I put my gloves on, I can grab my sterile field. And then with the 1-inch border, I will do this and put the shiny side down. I will also make sure there's no space in between so I can move this, and then I can position my box closer. Once that is done, I can take this and move it here. I will also take my loop and place it down here. And then I will throw it up above my waist. I would also like to note this table is not waist level. So I am breaking sterility with that. Then I will grab my catheter. Usually there will be a plastic cover on this, but I use it so much, there's not a plastic cover on it. And then I'll also move the box closer. I will dip it in my lube. For females, it will be 1 to 2 inches. And for males, it will be 5 to 7 inches. Then I'll also take my swabs. Wait, once I do this, I will get my syringe. And then I will fill it up. Next, I will get my swabs. With the urethra, I will go this way and then open it and dump it. Then I'll take another one and then dump it. And then I also do the same technique for man that I use for the pericare. I'll go to the meatus and go downwards. Then I will tell the patient that I'll explain the procedure to the patient. Tell them I'm ready to begin. I will dip this in the loop like I already did. And I will slowly insert it. I will slowly insert it with my dominant hand, while my non-dominant holds it open. Once it's inside for 1 to 2 inches, I will tell my patient to breathe through it. And for women, I can go in another 1 to 2 inches, but for male, I go all the way in until bifurcation. And then with my syringe that was already attached, I would do this, but I'm not gonna put my syringe in today because I don't want the water to get out. Okay. Once I do that, I will get my thing off, the lock, and then I will put it there we go. Then I'll put it on here. And then I will place it on the thigh. Once I place it on the thigh, I'm gonna undo it, and then I'm gonna just remove this. Next, I could take my thing. I'm gonna put this on the bed frame, not the bed rail. Okay. Then I'm gonna take my specimen. And then I'm going to place it in here without touching the outer cup inside the rim. And I'm going to place it back. Would like to know, I broke sterility trying to get up and down from there. With the tube, this would happen when I collect specimen from something that is not already, that is a new catheter. But if it was an old catheter, I will get the syringe. I will clip this and this. Okay. And then I will get this. And I will take this. From here, and then I would pull up till the urine comes out, and then I will put it in here without touching the rim of the cup. Next, I will put all of this up and then remove my gloves. Remove my gloves, and then I would document any color, consistency, odor, the amount, the location, the time, anything like that. And then I would get all my items up. Then for discontinue, I would put gloves back on. And then I will put the catheter. It should be in. And then I will slowly, with my syringe, I will release the pump by gravity with 0.5 milliliters by gravity. And then it will slowly come back. And then it will release, and then I will slowly pull this out. When I pull that out, I will document any color, odor, consistency, then I'll perform daily peri-care, how many or daily catheter care, how many times it was performed on the patient, and any things like that. And then I would also like to know any UTIs, such as cloudy urine, or any burning, or pain or discomfort to impede, and any. Okay, then I'll be documenting, and that'll be it. Thank you very much.